Hi, everyone. This is E. David Crawford, Editor-in-Chief of Grand Rounds in Urology. Joining us for our monthly update is Dr. Greg Murphy, who is a U.S. Congressman from North Carolina, District 3, and is also a member of the House Ways and Means Committee. Greg is one of several dozen physicians in Congress and is the only one actively practicing medicine today. Greg is going to provide us with some insight on something that touches all of us, and that is the current inflationary trends and its impact on healthcare. Greg, thanks for joining us.
Well, good morning, David. Thanks for having us. Thanks for having me. These are interesting times. If you look at the last 20 plus years, we've enjoyed as a nation very, very low inflation. And this has allowed for businesses to foster, people to gain wealth, personal wealth and well-being in homes and purchasing. But now we're seeing record inflation. In fact, prior to the Ukrainian invasion, we saw the highest inflation rate in over 40 years. And so much of that has to do with gas, but some of it has supply lines and some of the other things that are happening. And now that since Ukraine has happened and our problems with fuel are even further exacerbated, we're seeing now what is close in some economists' mind, close to double-digit inflation. And sadly enough, it's not going to go away anytime soon. And it's affecting us in medicine also.
Jeez. So what sort of impact specifically has this had on physicians and training and things like that?
Yeah, so let me share a slide with everybody here. And, I know we have an audience of many different ages. On one side, on the top, it's going to be this is about the median debt of graduating United States medical student adjusted to $2021. And so I'm going to tell you back here, and hopefully we can see this. This is the 1990. And as we move forward now, adjusted again in 2021 dollars. In 1990, that debt was about $50,000. Now, if you look up to now, median, half above, half below, debt for our medical students coming out of medical school now is close to $225,000. So let's think about that. That's the average amount, or the median amount rather. Folks walking out of residency, they already have a mortgage. They already have a mortgage without ever purchasing a house. So then we say, okay, well, what happens then? Doctors quote, or we're all rich is what the public thinks, and you and I know very differently. Let us look at what's happening with the inflation rate in Medicare. And this is, I'm going to put up a slide with Medicare updates compared to inflation. And this is going to be for the last 20 years. And it's going to be the cumulative changes. And I want folks to pay attention here, and I'll try to get the slide here. This increase over the last 20 years is what's happened to physician pay. You can see there was actually a drop, and then it slowly increased over the year. All right, that's physician pay. And then what the top is going to be, this is going to be what's happened with consumer prices as we've risen over the last 20 years. Again, this has been essentially flat. Consumer prices have done this. Inpatient hospital costs have risen up this much. So compare this again with physician pricing or physician payment, and then you put the hospital costs here. And we know this delta, and someday I have the slide actually on my phone. We really see so much of this delta has occurred here because of the bloat, I believe, and I attack it in the university systems, but I attack it in hospital administrations. We've seen such a massive increase in the cost of administrations in hospitals, and then a very, very small, modest increase in the payment to physicians. Some of that is not our hospital's fault because of so much regulation that's happened from our government. And honestly, this is why I'm really very pleased that now I'm on Ways and Means, because I'm actually on the health subcommittee, and we're the ones that oversee Medicare. And so we have to really dial back the insane amount of regulations that are been pushed on by our government and the subsequent costs. Now, some of the other administrative costs, both you and I know, in hospitals should not be occurring. And so this is really, it's a tragedy that we go back here, and this is what physicians are making. Our income has essentially been flat. And if you look at what the consumer price index has happened over the last 20 years. So sadly enough now, even in the face now of even worsening inflation, it's difficult for us to keep our practices alive, for us to pay our staff, to pay for, the things that we use in our offices, to keep our practices afloat. It's going to be a major, major challenge in the next several years.
That's worrisome data that you just showed us. Let me just follow up with a couple of questions. Ed, I know when I went to medical school and you, it wasn't even as high as you just pointed out, but $225,000+ in debt is just unbelievable. Yeah, the number of applicants to medical schools are increasing. I don't know if they know what they're getting into or what.
Well, I think it's a wonderful thing, David, because I think when you and I think that the same thing goes today, we have the brightest kids. We should have the brightest kids. They're the ones taking care of the health of us. We have bright kids with bright ideas about what they want to do with their life. They want to help people. And that's the best thing in the world. The sad thing is that the facts sometimes of what they're getting into, they don't really realize this. In some ways, they need to know the facts. And hopefully they're not going into medicine to be rich, because they're picking the wrong field. Both you and I know that, if that's the case. But we want the best and brightest to go into medicine for the right reasons. And it's good that we're still having a lot of folks apply.
So when you showed the physician income and Medicare, I hearken back to when I first started into residency and practice, and everybody says, "Oh, I had to walk uphill both ways to and from school." While you have my sympathy, but people got taken care of. There wasn't all these third parties involved. And do you have a break? I mean, to me, it seems. I mean, these people are doing very well. I mean, you see some of these large healthcare managers and organizations, United and many, many others, are doing well. How much is their income grown? Do we know that?
I can find that out. You mean for top hospital administrators, we know that they make, the upwards of, $2 million. Some of them are making $10 million. I know that one of the largest healthcare systems in North Carolina, that person makes over $10 million a year. And, the argument is, well, we want to get the best and brightest. I'm sorry, I don't buy that argument.
That is
the best and brightest are the physicians. The best and brightest are the physicians. And so I don't buy that argument whatsoever. I believe people should be well compensated, but I know that physicians work 70, 80, 90 hours a week at 2 a.m. in the morning. Those are our best and brightest. Those are the people who should be earning the most.
Yeah, and we know a lot of practices are being incorporated and bought out by venture capitalists and other organizations, and the impact on that. So as we, just not good news, and I think we all know that we're being squeezed. And we have Neil Baum does the thing for Grand Rounds in Urology every Friday on practice, and his talks are very good. And it's about your bottom line and how it's going and how you maintain it. And our people's bottom lines are sinking, and the costs are going up. And so let's try to end on some bright note. What's the light at the end of the tunnel here?
Well, the light at the end of the tunnel is, I think that a lot of folks are realizing this. Again, I don't want to put a damper on things, but reality is reality. We know that about a third of the urologists in the country are 65 and older. Half of them are my age and older, 59 and older. One of the reasons I still practice is there's such a need, is that hopefully our administrators, our surgical residency programs, we know, and I've been pushing this, and I'm pushing this hard in Congress, is to start get funding for more residency programs. We need to get more residents in the pipeline because we have to take care of more and more people. I think the value of medicine still is, yes, we want to earn a good living. We want to take care of our families. We want nice things. But the real value in medicine is the career that you and I devoted our lives to, and that's taking care of people. And that's not going to change. The remuneration may change, but the fact that we make a change in people's lives is what's critical. And I tell people in Congress here every day, the greatest job in my life is not being a member of Congress. It's being a doctor. It's being able to go into a patient's room and say, hey, your grandma is going to be okay. I believe we got all of her cancer out. That's the greatest job in the whole world. And that gives me, that gives me reason to be, bright about the future, to have an optimistic outlook, that we have students that are coming in that still care that much about medicine, that's what they want to do.
Yeah, and we sort of sometimes say we're going to be replaced by AI and trips to Walgreens and CVS and everything like that. And we have all these pathways to follow. And I think it's pretty well known. If you're a person that follows guidelines 100% of the time, you're not a good physician.
Yeah.
You got to do it most of the time, but you have to, like you said, individualize, and that's not going to go away. And in the clinic yesterday here in San Diego, I love doing it because I interacted with a lot of patients and hopefully help them. But Greg, thanks for your time again. We in urology, I can, speak on behalf of a lot of people, appreciate you. We appreciate your bipartisan approach. You care about us, and we care about you. And I hope a lot of us will continue to support you. So appreciate it. We'll talk to you next month.
Great. Thanks, David. God bless. Have a great day.